Hello, and today we're going to be talking about celiac disease. So, in terms of gluten pathophysiology, it's an autoimmune response to gluten. That's why people are getting these problems, this pain, this diarrhea, which we'll talk about after. So, it's due to gliadin, which is a part of gluten along with glutenin, but the point is, gliadin is modified during digestion by an enzyme called tissue transglutaminase. This leads to basically the formation of this certain complex made of TTG and gliadin. And these people with celiac disease have an anti-TTG antibody, and it will act on this complex and cause these intestinal symptoms from intestinal damage. In the UK, the prevalence is 1 in 100, and it can occur at any age. It's important to note, however, that there is a small peak between the ages of 1 and 3 as these people are first introduced to gluten. Now, the signs and symptoms these people get will be along the lines of diarrhea, steatorrhea, which is fatty stools. They will get bloating and may present with some weight loss as well. But other things to think about would be a potential for anemia and osteoporosis, which is the loss of bone mass. So make sure you go and clue yourself up on that. Mouth ulcers and angular stomatitis, which is inflammation of the corners of the mouth. So make sure in your GI exam that you check out their mouth. And something else to be immediately aware of would be dermatitis herpetiformis, which is actually present in 25% of patients with celiac disease. It is a subepidermal blistering seen in a quarter of patients, and 75% of patients who have dermatitis herpetiformis, so if you think about it as they present and they just have dermatitis herpetiformis, 75% of them have celiac disease, but only actually 20% of them will be experiencing GI symptoms. But the point is, this is a common sign that you should be looking out for. And it's an itchy papulovesicular rash. They have very small vesicles and tend to burst. I've drawn it here on the side of someone's wrist. But it has a chronic relapsing course. And when you see it, you should be investigating for celiac disease. Okay, so now on to risk factors. Basically, if you have a family history of celiac disease, you're more likely to get it. And so it's important to ask your family history when taking your history from the patient. Other autoimmune diseases like type 1 diabetes and autoimmune thyroid disease is important to note. When thinking about your bedside tests, you're going to want to complete a GI exam, and you're going to be looking for bloating, discomfort, dermatitis herpetiformis anywhere on the body, and if they have any obvious signs of weight loss. And of course, assess for pain. When thinking about what blood tests you're going to perform in these patients, you're going to be thinking about doing things like a full blood count and a blood smear, which would be looking for anemia, which is typically of the iron deficiency type, so you're going to be checking their ferritin, but you can also therefore rule in or out a B12 or folate deficiency. You're going to be looking at LFT, to look at their ALT and their AST, because it may show raised transaminases. Check their calcium and maybe even their albumin, and you're going to want to skin biopsy any DH that you see. And you're also going to check their glucose and TFTs for autoimmune diseases, and check their DEXA scan. In terms of imaging, you may want to perform an abdominal X-ray, because that will be to rule out some other differentials. Your special test will be along the lines of anti-TTG, and you will also want to perform a biopsy to confirm the differential, which would show villus atrophy and crypt hyperplasia. And here I've drawn sort of the difference between normal and celiac disease there, showing villus atrophy as they've got smaller. And to look at crypt hyperplasia, it's about an elongated groove on the intestinal lining. The management of celiac disease is basically a gluten-free diet, and it's important to note when doing the previous test to make sure the patient is in a gluten-inclusive diet. Gluten is included or present in bread, pasta, rye, barley, but surprisingly maybe in some sauces and oats. And another form of management you may want to perform is testing their micronutrients to see if they've got any deficiencies in calcium, anything like that, and then you can replace. Alright, well thank you for watching to the end. This is just a sort of test for me. I'm going to try and make the videos better. I messed up the resolution, that's why there are black bars. But all the information is really what you need to know. And so yeah, but that's the first one, and I'll add more conditions as we go along.